All right, welcome to your med school crash course. Today, we're going to slice through all the clutter and focus on 10 medications you absolutely positively need to know. We're going to make it quick, clear, and hopefully stick in your brain. So whether you're cramming for a test or just need a solid refresher, let's do this. Pharmacology can feel like you're trying to learn a whole new language, right? It's just endless lists of drugs with crazy names and even crazier side effects. Well, this explainer is all about cutting through that noise and giving you a rock-solid foundation on the meds that really matter. So, to make this all a bit easier to digest, we're not just going to throw a list at you. Nope, we're organizing these drugs into logical squads. First, we'll meet the heart and pressure patrol, then we'll call in the infection fighters, and after that, we'll do a quick round with the gut, pain, and sugar regulators, and to wrap it all up, we'll lock it in with some golden rules. Let's get to it. First up, our cardiovascular team. Think of these as the crew that keeps the body's engine running just right. They manage everything from blood pressure and heart function to fluid balance. Basically, they keep the whole system from either burning out or flooding. Our first patrol member is lisinopril. It's an ACE inhibitor, and it's a real workhorse for treating high blood pressure and heart failure. So what's it actually doing under the hood? Okay, so lisinopril's job is to stop the body from making a chemical that squeezes blood vessels tight. Imagine it's telling a tense water pipe to just relax. That opens up the pipe and lowers the pressure inside. Now, a dry cough is a pretty common, annoying side effect, but the one you really have to watch for is angioedema. Any swelling of the face, lips, or tongue is a medical emergency because it can shut off the airway. That is absolutely non-negotiable. Next up, we've got furosemide, but you've probably heard it called by its trade name, Lasix. If the body is holding on to way too much fluid, causing swelling or putting a major strain on the heart, furosemide is the one they call to get all that excess fluid out. Furosemide basically works by throwing open the floodgates in the kidneys, which causes a huge increase in urine. But here's the catch. As all that fluid rushes out, it takes a bunch of important electrolytes with it, especially potassium. Low potassium or hypokalemia can lead to serious heart rhythm problems. That's exactly why we're always monitoring labs and teaching patients about eating potassium-rich foods. And here we have digoxin. This is a really interesting drug with a very specific two-part mission. It's a dual-action powerhouse. It helps a weak heart pump stronger, and at the same time, it helps a fast, chaotic heart beat slower and more efficiently. So the most important thing to get about digoxin is its super narrow therapeutic window. That means the line between a dose that helps and a dose that harms is incredibly thin. We have to be on high alert for signs of toxicity, like nausea and vomiting, and the really classic one, seeing yellow-green halos around lights. And that brings us to the single most important safety check for this drug. Listen closely. Before you ever give a dose of digoxin, you must check the patient's apical pulse for 1 full minute. If that pulse is below 60, you hold the dose and you call the provider. This is the absolute golden rule. No exception. All right, rounding out our heart patrol is a drug you've definitely heard of, Lipitor, also known as atorvastatin. This is one of the most prescribed medications on the planet, and its job is to lower that bad LDL cholesterol. Lipitor works by blocking a key enzyme that the liver needs to produce cholesterol. It's super effective, but the critical watch out here is muscle pain. Any unexplained muscle soreness needs to be reported right away because it could be a sign of rhabdomyolysis, a rare but very serious condition where muscle tissue breaks down and can cause severe kidney damage. Okay, let's switch gears. We've got the heart under control, now it's time to fight off some invaders. This next squad is all about targeting and eliminating harmful bacteria with tactical precision. First on the scene is tobramycin. Now, this is not your everyday antibiotic for sore throat. This is a heavy hitter from a class called aminoglycosides, and it's reserved for really serious gram-negative infections. So how does it pull this off? Well, it basically shuts down the bacteria's protein factory, so the bacteria can't build or repair itself, and it just dies. The key thing to remember with tobramycin are the 2 T's, toxicity. First is nephrotoxicity, which is kidney damage, and the second is ototoxicity, which is hearing damage. That's why we're constantly checking kidney labs and asking our patients about any ringing in their ears or dizziness. Next up on the infection-fighting team is Bactrim. This is another really common antibiotic, especially for things like UTIs, but it attacks bacteria in a completely different way than tobramycin does. Instead of going after proteins, Bactrim blocks the bacteria from making folic acid, which they absolutely need to create their DNA. And hey, no DNA means no replication. Game over. The number one most important thing to teach your patient here is to report any rash immediately. A lot of rashes are no big deal, but it could be the very first sign of Stevens-Johnson syndrome, which is a rare but life-threatening skin reaction. So let's do a quick side-by-side to really lock this in. It shows you how tactical these antibiotics are, right? Tobramycin shuts down the bacteria's protein factory. Bactrim, on the other hand, blocks its ability to even make DNA. Two totally different targets, but the same mission: wipe out the infection. All right, time for our last group of meds. This is kind of a mixed bag, a trio that handles some of the most common issues in the body: digestion, pain, and blood sugar. Let's hit these in a rapid-fire round. Okay, let's knock these out one by one. First, Colace is a stool softener. The key here is it prevents constipation. It doesn't really treat it once it's bad, so tell your patients to drink tons of water. Next, naproxen is an NSAID for pain. The rule is always take it with food to protect the stomach and watch for black tarry stools. That's a classic sign of a GI bleed. And finally, metformin for type 2 diabetes. Take it with meals to avoid stomach upset, and the absolute must-know, can't-forget rule is that it must be held before any procedure with IV contrast dye to protect the kidneys. Whew, we've covered a lot of ground, so now let's just zoom out for a second and pull everything we've learned together into a few core principles that pretty much apply to every single medication you'll ever give. These are the 4 golden rules that tie it all together. Number 1, monitor what matters, like potassium levels for furosemide or the heart rate for digoxin. 2, know the red flags and act fast, like that facial swelling with lisinopril or a rash with Bactrim. 3, always, always, always check for allergies and other reasons a patient shouldn't take the drug. And 4, educate. Your patient is your number 1 partner in making sure these meds are taken safely. You've probably heard this before, and there's a good reason it's a classic. This little phrase is the ultimate summary of our responsibility. Every single time you give a medication, it's a critical thinking exercise to make sure all 5 of these rights are met. So we've talked a lot about what these drugs do, but true mastery comes from understanding why they work. Knowing the mechanism of action is what lets you anticipate side effects, answer patient questions, and really understand the whole picture. So, which one stood out to you? Thinking about that why is what separates the novices from the real experts. Thanks for joining me.